Hi, this is David Comfort from Democracy Action Network. Here's what's actually wild. On July 4th, 2025, President Donald Trump signed a bill that cuts over $1 trillion from Medicaid, potentially stripping health coverage from more than 11 million lower-income Americans. This isn't just a political maneuver, it's a declaration of war against the working class and the sick. Ever notice how the richest among us seem to benefit while the most vulnerable are left to fend for themselves? This new legislation, dubbed the One Big Beautiful Bill Act, is a continuation of a right-wing campaign against public health that has been brewing for years. The cuts to Medicaid and Medicare are staggering, with nearly $500 billion slashed from Medicare alone. The implications are dire. Tens of thousands may face early death as access to essential healthcare is yanked away. What if I told you that these cuts are not just about saving money, but are part of a larger ideological war? The Trump administration has shown a blatant disregard for public health, evidenced by the mass firings at the Department of Health and Human Services. They've dismissed a quarter of its workforce, targeting teams crucial for disease surveillance and outbreak investigations. This is not merely chaotic governance, it's a systematic dismantling of the very institutions meant to protect public health. Let's connect the dots here. The cuts are framed as necessary for tax reductions for corporations and the wealthy, but they come at a catastrophic human cost. Public health measures have historically been the backbone of our society, contributing to significant increases in life expectancy through initiatives like clean drinking water and vaccination programs. Yet, these efforts are now being undermined by a government that prioritizes profit over people. The absurdity of this situation is amplified when you consider the appointments made by Trump, individuals like Robert F. Kennedy Jr., a notorious anti-vaccine advocate who now leads HHS. The new leadership appears more interested in promoting pseudoscience than in safeguarding public health. This isn't just a political failure, it's a moral outrage. But here's the silver lining. The medical community is waking up. Doctors, researchers, and public health professionals are beginning to mobilize against these attacks. They're recognizing that the fight for health equity and scientific integrity is intertwined with the fight for a just society. We need to channel our outrage into action. The current assault on health systems is not just about resisting Trump's agenda. It's about envisioning a future where healthcare is a right, not a privilege. Imagine a universal healthcare system that serves everyone, regardless of income. That's not just a dream, it's a necessary goal. Together we can confront these challenges, advocate for reforms, and ultimately rebuild a health system that truly serves the public good. The path ahead may be daunting, but it's a puzzle worth solving. Let's get to work. This is David Comfort from Democracy Action Network. Please like this video and subscribe to our channel. It would help out a lot. Peace.